all this backseat driving.
I know.
I do.
Carol LaRoche.
Let's cut my head.
There we go.
Okay. Okay, so let's go back over here. And I can just cut this front part when we
So we should
do
be
it.
live. Now, yep, Bigette's on there. Can they hear?
They can hear
See,
us,
she
yes,
sees us.
but don't talk to them yet. Why don't you-
Yes, she can hear us. Okay.
Mhm.
All the good stuff happening.
See,
Like your neighbors know. Right.
okay, you can go anytime.
All right. So welcome to everybody who's out there watching. We're really excited, and a big thank you to Interskagen Bank for sponsoring this webinar series. We're excited to introduce Dr. Laura Blaisdell today, a great friend who's got tons of experience medically and also in the camp world. So we so appreciate her being here today to talk to us about, and I'm going to read a little bit, infectious disease surveillance and prevention, what policies and procedures camps might consider in the era of returning vaccine preventable diseases. So this is a little bit of a follow-up to a session that was done at MIGUS in September, and it was so popular. A lot of people were interested in hearing and may still have some unanswered questions. So we're really appreciative of you being here today, Laura.
Thank you. Thank
You're
you.
welcome.
Yeah, so can we pull up the
We sure can.
slides? I'm going to go through some slides today and hopefully leave plenty of time for questions at the end. I know each camp is different and every camp is struggling with different aspects of summer issues with infectious disease at summer camps. So we're going to briefly go over today the Maine CDC Infectious Disease Program, how you notify and report diseases at camp, and then we're going to talk about vaccine refusal and hesitancy and what camp directors need to know about this and managing it for your camp. So first of all, I always like to make sure that we understand why it's important that we're talking about this. So we know that outbreaks make kids and staff sick. They create stress and confusion. They can disrupt camp programs. I always remember Swine 09, where we had shadow camps at Camp Winnebago. The outbreaks can be difficult to control. They're tricky to explain to parents what's going on, and parents are often very anxious about what's going on. Camps are responsible for vaccine records and outbreaks right, especially now, create news. Oh, I'm not able to move forward, Ron.
Okay. I can't hear you.
Okay.
That's
Oh, there we go. Now I'm back. So summer camps are a place of increased risk for disease. There's a great deal of density, a lot of people living, socializing, interacting in a small area. There's a lot of diversity, wide variety of individuals coming from different backgrounds, geographically, and different social habits. There's a traveling population, so the transience of kids and staff in and out of camps puts camps at risk. Certainly, there are some ages of children who are trying experimental behaviors.
Can you hold on one second,
Sure.
Laura? We're having some technical difficulties.
People are,
If you can just wait one moment if you're out there with us. We are just trying to make sure the slides are viewable. So sorry for the interruption. You think it's okay now?
You asked for Jen.
I can see. Okay, great.
Okay, great. All right, so now everybody can see the slides.
Yeah.
So I'm continuing on why summer camps are at increased risk for infectious diseases. Infectious diseases are often difficult to track because the home address for the camper is often out of state, which means that various state CDCs don't necessarily receive timely disease reports. Certain diseases are a greater concern to camps. There's certainly gastrointestinal illnesses, vaccine preventable diseases, including influenza, rabies, vector-borne diseases like Lyme, and then other common childhood illnesses, hand, foot, and mouth, staph, strep, and hopefully we don't see too many sexually transmitted infections or TB anymore. Some real life examples of infectious disease outbreaks at camp we've had a lot of pertussis or whooping cough at camps. Norovirus is the 24-hour vomiting outbreaks. We've had salmonella in cooking staff. We've had cryptosporosis and E. coli at a farm camp. Lots of concern about what comes from bats. And then really feel like with the recurrence of measles in the United States, we got pretty lucky this summer in not having any outbreaks of measles in camps. So let's talk a little bit about how we work with the state to report and investigate infectious disease outbreaks. So notifiable diseases are reportable to the Maine CDC when you have a recognition or a strong suspicion that there is an outbreak. There are two categories of notifiable diseases, Category 1 and Category 2. So Category 1 are those immediately by phone calls to the Maine CDC, especially if there's an unusual cluster or unexplained serious symptoms. And then Category 2 falls into those less concernable infectious diseases. If people haven't seen this list, oftentimes it's sent to camp directors. I know that we have it in our health center, but this is the notifiable conditions and diseases list, and it also has that telephone number and how to reach out to individuals at Maine CDC.
So this would be something you would post in your health
This
center?
would be something that would be posted in health centers, and if you don't have a health center, then you certainly want it in your office. Not that you would necessarily know how to identify leptospirosis, but that you would know that if a lab came back from one of your campers or staff, say, and they said, this staff member has to be treated for their Legionella, that that needs to be reported. This is the list of required reporters. Camps aren't specifically listed there, but any healthcare providers within camp, and I think that anyone who is working in close vicinity with children would want to consider themselves a required reporter. Why report it? Well, first of all, it's required by law. Second, I think, but perhaps most importantly, is to intervene to evaluate the risks of transmission and prevent the spread of disease. We also want to report so that the Maine CDC can help us with managing disease incidence and prevalence, and the Maine CDC is trying to track all of these notifiable conditions and report them to the US CDC so that we have really great data about where these diseases are, and it becomes increasingly important in this day of transience and interstate and international travel. It's pretty easy to report. There's some slides at the end here that will also talk about resources, but maine.gov/IDEPI is the disease reporting tab. You can also call. There's always somebody on call. The poison control is on call after hours, and they will be the ones to triage your call, and you can also email disease.reporting@maine.gov for non-confidential reports or requests for consultation. after one report, say you have a concern that one of your campers is coughing and has the characteristic whoop, and you call the Maine CDC and say, I think we might have whooping cough at our camp. The reports and consultation requests are assigned to one of the field epidemiologists, which is usually done by region. And the field epidemiologists you should think of as your friends. They're going to be the ones to help you establish communication, identify one point of contact for your camp, help you assess the current situation, collect any data that's needed. They will provide guidance for you on how to monitor children, what sort of quarantining would be necessary for each disease, talk about and arrange for specimen collection, guide you to local services if necessary. And they can also provide you really important guidance, template letters, disease fact sheets that you might need to communicate with parents. I guess I'll just say most people find this reporting a little bit nerve-wracking to do, but once they meet the field epidemiologist that is helping them, most camp directors that I've talked to have said that's really, they became a very helpful friend in that situation to help them manage an outbreak. I just wanted to say a special word on rabies because it comes up in nearly every camp season. So if rabies happens in a domestic animal, you'll want to contact the animal control officer or the Maine CDC for whether or not the person bit needs post-exposure prophylaxis. Usually animals will undergo a 10-day observation, and severe attacks may require expedient response and treatment regardless of that observation. Wild animals, which is what a lot of us are dealing with at camps, if available, you try to trap and submit the animal for testing. You can draw straws for who's going to be the person to do that. It would not be me at our camp. You want to contact the game warden if needed to trap the animal, and the Maine CDC as well. Post-exposure prophylaxis is only recommended in rabies positive animals. And if the animal is not available, then you just want to consult the Maine CDC right away. And there's always multiple bat exposures. You want to try to list those who were potentially exposed and try to bat-proof buildings as much as possible, although despite doing that, those of us who live at camp know that bats happen. So to review, do you want to know as a camp director what to report, when to report it, how to report it, and to whom to report it. You want to know your local and state health websites. You want to know who to call. It's probably good preventative relationship building to have a local healthcare provider or clinic for medical referrals and follow-ups. We'll talk a little bit more about making things simple in preventative measures and vaccination clinics. And then when and if there is an outbreak, you want to make sure that your health department has a single point of contact, that you don't have communication management certainly is an issue at camp. When parents are calling the health department and you're calling the health department and perhaps our nurses are calling the health department, you want to be really clear that there's one point of contact. So I'm going to, please feel free to raise your hand if you have any questions. I will leave some time at the end. But I'm going to go into vaccine preventable diseases and summer camps. So vaccine preventable diseases are those diseases that we have vaccines to prevent or to decrease the side effects of. Many of us have seen the recommended immunization schedule. This one is a little bit more friendly than the CDC schedule that is sometimes put up and looks very confusing. But on the right-hand side there, you see the list of diseases that we have vaccines to prevent. Vaccination coverage across the US is variable. Here in Maine, about 66 to 71% of kindergartners are appropriate, sorry, this is 2-year-old data, are appropriately immunized, but that varies there's various rates across the US, and that has to do with exemptions and access to vaccinations. In Maine, parents can opt out of vaccinations for personal belief reasons or with their doctor for medical reasons. Up until last year, Maine was one of the 18 states that had all 3 exemptions from school-required immunizations. That's medical, religious, and philosophical exemptions could be obtained. Maine, because of this, has a really sad rate of kindergartners who are not immunized, 6.1%, and we've been watching that rise at about 0.5% per year over the last 5 to 10 years, and that makes Maine one of the worst vaccination rates in the nation. We have the worst rate of pertussis in Maine, or whooping cough. And interestingly, based on those exemptions that Maine individuals could claim to not get their children immunized, only 0.3% of them were for medical exemptions. So the vast majority of exemptions in Maine are one of those personal belief reasons. So Maine's rates of immunization vary across counties. The detail in this slide is not as important as just to realize that there are counties that are at higher risk. There are some schools who have measles, mumps, rubella rates of vaccination below 50%. So it is something that it is the reason why we're seeing outbreaks here in Maine and why it's become an issue for schools. So some of the outbreaks that we've already experienced here in Maine, we've had whooping cough outbreaks. Most of us have read about that in schools and daycare centers. We've had chickenpox outbreaks. We've had mumps outbreaks. We had our first measles case in 1997. Since then, we've had 2 near misses of measles that people had measles and were traveling through Maine, but that did not spread to any local Mainers. So I was involved in this past spring to pass a law to require immunizations as a condition of school entry, maintaining the right to opt out of immunizations if there was a medical reason for a kid not to be immunized, of course. This law did pass, and it applies to all private and public elementary schools and secondary schools, daycares, universities, and colleges, and certain healthcare facilities like nursing homes. Notably, it does not apply to summer camps, but I'll hopefully convince you by the end of this presentation that we might want it to apply to us as well. There are a limited number of vaccines that were included in this law. You can see diphtheria, tetanus, pertussis, measles, mumps, rubella, polio, chickenpox, and meningococcal meningitis. Those are the diseases that are most communicable in social settings. Of course, we want our healthcare workers and our particularly at-risk vulnerable children to be protected through additional immunizations. I think it's really important for those of us who live in Maine and might hear more about this law as it goes through a referendum in March, that this is not mandatory vaccination. This is vaccination as a condition of school entry. People can still choose to not vaccinate their children. They just won't have the liberty of attending public schools because we have plenty of kids in public schools who can't be vaccinated due to various illnesses, and teachers and staff to be included as well. And the reason why both religious and philosophical exemptions were removed was because with no major religion against immunization, religious beliefs are essentially personal beliefs. That was the interpretation by our legislators and by many of us in this area. So why does this matter? Why does legislation like this matter to camps? So in June 2019, New York State passed a bill to end religious exemptions. They did not have philosophical exemptions, just religious exemptions. And they did that in the setting of their measles outbreak. The health commissioners required all summer camps in June to send proof of immunity for all campers and staff. Now, I know that in June you have plenty of time to track down all of your immunization records for your campers and staff, but this was horrible timing for the New York camps. And it also, in addition to the administrative nightmare of obtaining all of these records, it can take 30 days to get up to camp get up to date. Up to camp is something different. Up to date on measles alone, and it can take 14 months to get up to date on all vaccines. So if you have a non-vaccinated child attending your camp and there's an outbreak in New York, that child was essentially not coming to camp for 30 days. In Maine, Maine law requires us to keep a record of all vaccinations for staff and campers, but the law does not require mandatory vaccines for summer camp attendance yet. I'd like to argue that camps could or should follow the school recommendations because not only is it recommended by the American Camping Association in their policy that was written jointly with the American Academy of Pediatrics, but in an outbreak, healthcare leaders could mandate vaccination for camp attendance, and then like New York, we'd be scrambling at the last moment. So I'd like to encourage Maine camp directors to consider policy changes now to minimize disruption during the summer season. So this is the policy statement that was jointly written by the American Camping Association and the American Academy of Pediatrics, creating healthy camp experiences. Some key points about this policy is that they recommend before starting camp, all campers should be in compliance with the recommended immunization schedule established by the AAP and the ACIB, which is an advisory committee on immunization practices of the CDC, which is the Center for Disease Control, and also the recommended schedule is the same for the American Academy of Physicians. This policy statement goes on to recommend that camp administrators should be aware that individual states might require other immunizations in addition to those recommended by AAP. And that non-medical exemptions to required immunizations are not appropriate and should be eliminated by camps. So there is a little support for camp directors saying from the American Camping Association and the AAP, should you want to consider changing your policies here in the off season. Policies also should be in place for by camp administrators regarding the participation in the camp program by campers who are incompletely or are unimmunized. And lastly, people who travel internationally as part of a camp program should consult the CDC traveler's website or visit a traveler's website for information regarding particular immunization requirements for health concerns that may be associated with the destination they are coming from or going to. So what should camp do in preparation? You know, we at Camp Winnebago are not an electronic health record, but certainly considering investment into an electronic health record for immunizations in particular can be helpful. There are so many immunizations it's very hard to keep track on paper record. Camps should also consider the creation of a vaccine policy and make parents aware of this vaccine policy during the recruitment season. The camps will want to consider the creation of an under or unimmunization policy, and consider screening and camp policies on attending while sick. Screenings will coming into camp and intermittently throughout camp, and revamp one's policies on attending and staying in cabins, etc., while campers have fevers and coughs. So this is a sample immunization policy that we created at Camp Winnebago. I am happy to forward it as an example of what other camps might use. It does follow the schools and mandate immunization for attendance. Last year at camp, we did a softer rollout of this. We did not say that it was mandated to be fully immunized for camp attendance, but we did hint at the trend that the tide might be turning. This outlines to parents and staff what will happen if an unprotected camper or staff has a cough, fever, or rash. I think that's really important to protect you as a camp director. And it outlines to parents and staff what will happen to other unvaccinated children or staff should they be exposed to fever, cough, or rash. So camps, I think rightfully so, worry that mandated immunization for camp attendance will decrease enrollment. In speaking with some camp directors from New York State, despite the abrupt change in policy in June, that they reported only 1 or 2 instances did 1 or 2 families withdraw from their camp experience for their child, and they heard an overwhelmingly positive response from many parents saying thank you for protecting my camper at your summer camp. We have similar data out of the California school system that passed in 2015, a similar bill to Maine, where vaccination was a condition of school entry. And despite the vitriolic language around what might happen when this bill passed, it just simply demonstrated California experienced increased vaccination rates and not a drop in school attendance. But we'll have to learn more as we go through this. So I think it's really important, despite what one does with their vaccination policies, it's very important that we are always on our toes in watching for preventable diseases. And I think an ounce of prevention is worth, its weight in gold. So I think it's important to educate parents and caregivers in the role of illness prevention before camp begins. Please don't put Johnny on the bus from New York to Maine with a fever, or if you do, can you please let me know that Johnny and Jane, who's going to the sister camp, are both coughing. It's at Winnebago, we establish opening day screening processes, as I know that many of you do. And you might want to consider the right to refuse admission if needed. If somebody shows up with something that looks and smells like measles, you might want to keep that camper out of the camp until contacting the CDC. It's important to establish, implement, and promote policies that prevent the spread of disease, and we'll talk a little bit more about that and about isolation. It's important to establish policies to keep the staff healthy, and regularly evaluate and update your healthcare practices and procedures. And certainly our health department can help keep you up to date on information and recommendations. If you don't already sign up for one of the listservs from the Maine CDC, you might decide that you want to do that, particularly because they send out great surveillance data in Maine. So how do you even recognize an outbreak? I think some major kind of 50,000 foot view, is there a sudden increase in similar symptoms between campers? And I think that's probably, these are probably elementary things for seasoned camp directors, but perhaps something to pass on to our staff that might not be used to identifying and monitoring symptoms in kids. Can the majority of illnesses be attributed to 1 or 2 symptoms? Typically, a cold will have a cough, a runny nose, a fever, but if there's just vomiting and diarrhea, or there's just a rash, or there's just a fever, those things are a little bit less likely to just be the common cold. And then is there a potential source? Are the individuals linked by person, place, or time? Did everybody who came back from Mount Blue all of a sudden have bites that look like they could be scabies, etc.? So this is one of the slides that I present at Camp Winnebago to our staff about surveillance and prevention. So in addition to surveillance for diseases, we also talk about sneezing etiquette, sunblock, hand washing, hydration, hygiene, insects and animals, and pooping. You know, it's always important to know how to poop at camp, and how much of what our health staff sees is constipation is probably it's overly reported at summer camps, I think. I think it's really important, and I stress at camp, at Camp Winnebago, that our frontline staff are really the people who are going to be noticing signs and symptoms of illness. And so I encourage them to be curious about any sorts of rashes, and they need to know that they're also the front line of the boring aspects of prevention, which are hand washing, hygiene, cough and sneeze etiquette. Some other recommendations that the Maine CDC has is, you know, certainly promoting hand washing before eating and after contact with animals, not letting campers drink unpasteurized raw milk, cider, any high-risk foods, promote healthy swimming and avoid ingestion of untreated water. Again, I don't know how that, I have trouble figuring out how that would happen at our camp, but we try. We don't encourage kids to drink lake water. You might want to consider switching from self-serve buffets, or ensuring that the self-serve buffets have the sorts of, you know, see-through glass, and, you know, when spoons get dropped into the broccoli salad, that kids are told not to reach in, but that there are other spoons available to go ahead and use a spoon, excuse me. Never let campers handle wild animals. Chewonki is good about that. They, you know, carry the animals around, but don't ask the campers not to touch. Generally not sharing personal items or towels. Cleaning high-touch surfaces and bathrooms often. Good respiratory etiquette, including good sneezing etiquette, and just making sure that there's enhanced surveillance with your frontline staff. So this is a little bit, this is a repeat of some of the ACA, AAP policy statements that I think is really important. I guess I'll assign that as reading to folks who are on this call afterwards. Just to, it's a great policy statement and really highlights some of the things that are really important for us to be thinking about generally in health at camps. And that's it. I'm not going to go bullet by bullet because I want to make sure that we have time
for questions. Accessible? Where would we find
Yes. So in this resource section, these slides, so here's the Maine CDC reporting, the school health manuals, rabies management guidelines, some other Maine CDC information, and this AAP camping statement. That's the hot link for the full PDF. To those recommendations and guidelines.
And we will post this slideshow along with posting the video of this webinar for everyone to access.
Terrific.
Okay, so
well, that leaves us about 20 minutes, and I think that's important. So if people have questions.
While we're checking to see if other people out there have questions, Laura, talk about, you know, when you have campers that obviously are coming from different states, but often internationally, where it's very different what the immunization expectations are, and maybe in different languages and all those kinds of things. What do you recommend a camp do to manage the percentage of international campers?
Yeah, I think international campers are generally well immunized, although you won't necessarily be able to read their immunization record.
Correct.
I think that is one of the biggest challenges of our international campers at Winnebago. So, you know, getting those, especially for international campers, getting the immunization records in as early as possible so that you can subsequently either talk to your pediatrician that you work with and helping to translate that, and knowing what vaccines are on there.
Mm-hmm.
Like I said, again, typically the vaccine preventable diseases are less of a concern for international campers because typically they are well vaccinated, but some of those other reportable diseases, are out there. I don't think necessarily tuberculosis is going to be something that's going to be coming, but we don't typically immunize against tuberculosis in the U.S., but it is something that we do test for and we would want to be watching out for as well.
Mm-hmm. And so you listed what we are now requiring in the state of Maine since LD 798 took effect. So would those be the ones, often the question is your child immunized for school entry? Well, again, that's different in different states.
Yeah.
So a better question, I mean, obviously having them list out what their immunizations, but we should really be looking for these 2, 4, 5 in particular.
Those I think are important. They're minimal in terms of if I can take off my public health hat and put on my pediatrician camp doctor hat. I would like to see, and as the Maine AAP the AAP and the American Camping Association recommend that children be fully up to date with all immunizations as recommended. That includes many more immunizations than are on that list. And that one slide that had the entire list would be more consistent with what I would be looking for. Certainly things like hepatitis A, which is a foodborne disease that we have many outbreaks now in the US because of the world food, the nature of our international food market. That would be something I would want children to be immunized against. Another example of something that's not on there is Prevnar, which is a vaccine against pneumococcus. That's not required for on Maine's state laws. It's not required, but it's kind of a bedrock immunization in my mind. It prevents incredible since its inception. It's prevented invasive pneumonia in so many of my patients. I hardly see it anymore.
So, and is that something that's recommended? Is that on that list that you showed us?
It is. Yeah. It is. Yeah.
Do we have other questions from the group?
No questions are popping up. One thing I think it's important for camps to know is we learned last week that DHHS is going to be reviewing and changing the regulations or rules for summer camp. And I'd be willing to bet immunization will definitely be one of the ones that they will, because right now in the regulations for camps, it says you don't have to.
Right. I think one of the issues that we have here in Maine is that depending on who oversees the institution, daycares and summer camps being under licensing.
Right.
You have schools under DOE. I have healthcare facilities under Maine CDC. When I was reviewing those regulations, they're different for each institution, and it doesn't make sense that they should be different. So that is something I've been bringing to the Maine CDC leadership, and I also feel like without any clear guidance from our leadership at DHHS, it leaves summer camp directors a little bit in the lurch with nothing to kind of fall back on to say, I'm doing this because it's part of my licensure process. You have to be immunized. So. Yeah.
Trying to go. What other questions might be out there from people?
I wonder if anybody in the group has had pushback from parents or has had challenges in talking with parents about immunizations. It's certainly a hot topic There's a couple ways to ruin a dinner party, and talking about our current leadership, I think, is one, and vaccinations is another. And I wonder if the folks on the line, or if you have had contentious or heated conversations with parents, and if so, how did they go?
We have found that the majority of our camp family has been bought into and immunization and are immunized, with very few exceptions that I can think of over the years that for philosophical reasons were not. So it hasn't been a problem thus far. It's more the logistics, I think, of getting all the information and it being presented. We actually started using electronic health records, but they can either enter the data or scan a form. So still you're getting often a scanned form that may look different than depending on what state they're from.
Yeah.
So I think that's the biggest challenge for the health center, is to navigate all that information and be able to go through it and make sure they know who is and who isn't, since it's not a mandatory thing.
Right. And vaccines come in different combinations with different names. Mm-hmm. Sometimes they have HIV in them and sometimes they don't.
Right.
Sometimes HIV is given separately. So yeah, it can be very confusing for the health staff when they get a scanned document. It would be wonderful if pediatricians' offices and health records could all look the same and speak the same language.
Yeah. So as far as going to staff and international staff, one of the challenges I think is also, American staff, because they really have to present a lot of information when they go to college. If they're attending college, you typically have that information readily accessible. But I feel that it's a little bit more difficult to get the actual documentation from international staff. Mm-hmm. And, should we be asking for actual sort of medical documentation, or is it okay for them to complete a form that tells the dates which they had certain vaccinations?
I think either is probably okay. Certainly, I don't know if the organizations that bring international staff, is that different? Do they provide immunization data?
That's a good question.
Or can they?
Yeah, we should look into that. I'm not sure. We should ask.
If it could be moved to kind of a process
as part of their
processing. But certainly, I think either, it's very common in the college age students to choose one of these opt-outs. They have been choosing just a philosophical exemption because it's easier. I mean, when I was 19, I didn't want to go try to find my MMR status. But certainly, if it's mandatory for employment, that'll encourage individuals to find it. And there's also, one can always obtain a titer, right? So if somebody says that they don't know their immunization status, you could ask them to demonstrate a positive titer. That's a blood test that they do that shows that they have they have enough antibodies against a certain vaccine. Depending on how important it is, yeah. And something like measles, given the nationwide and worldwide epidemics that we're seeing. Andy and I went to visit a camper in Colombia, and we were greeted at the airport with, if you have measles, if you have any signs of measles, please don't come into our country. So it's not just a U.S. issue, but so a disease like measles, is so transmissible and could really ruin your summer. So you might decide that you put a little more of a line in the sand like that, as opposed to it's hard as a pediatrician to pick a disease that you think is okay.
Right.
But maybe polio. Maybe you don't think that necessarily
As likely.
is as likely to be having an outbreak of polio.
All right.
Any
other-
No, this was from early on. So
Okay.
either there's a glitch in our system or there are no questions.
Do you want to see if we have any?
We could also, I don't know if there was an email that was sent out.
Here we have a question.
Oh, okay.
Oh.
All right. Jet says, we have had challenges getting parents to complete forms in general, like health forms. We have to often personally call. We feel that parents will not input the data correctly if they needed to input the details of each immunization. I think that that's right. I think even just getting an immunization record is a win.
Yeah, and I think we've definitely found since we switched to electronic records, to be honest, that we've had better compliance. And the nice thing about the electronic records is it saves information from year to year. Now they do have to update immunizations, but at least you've got the basis. They do have to update things, but it's also easier for parents. They don't have to input everything, all the address and the whole form stuff that we used to all do by hand.
Right.
They don't have to redo that. So it is a time-saving element for parents, which I think is a huge, benefit to the parents. And so all they have to do is log back into their account, confirm certain information, and re-upload like this year's health form and updated immunizations. So it's pretty basic.
I wonder about I am clearly the medical staff, and if Andy were here, I would ask him this question. But what is the role of incentivizing or disincentivizing non-compliance in health forms and forms in general? I mean, could you say an early bird special, you'll save $25 if you get your forms in on time? You'll lose $25 if you don't. Is that what do you think about that as a camp director?
I think that often the people who might fall short in those areas either wouldn't care, that much about that, the money. I think the reality is we're going to have to keep. We have to know that we're going to devote some manpower hours or woman power hours to following up. Yeah. The other
There's not a list of shame.
Yeah.
On the website.
The other nice thing about having electronic stuff is it's much easier to, through the system, send emails that say you still haven't done it, you still haven't done it, you still haven't done it. But the phone call inevitably does end up happening still to some.
Yeah. Is there any
But yes, absolutely. If your forms aren't complete, you cannot come to camp.
Right.
So that's the ultimate.
That's the ultimate.
Yeah.
Right. Although that's also difficult to
impose.
Yeah.
But you had in your forms some very specific things that if your child comes to camp and has something, the parent has to cover the cost of going home or anything else right away. And some language like that might help.
Right. Yeah.
Nobody wants their kid to have to go home on day, opening day.
Yeah.
They
won't be allowed in program until
Okay.
Good. Yeah, I think one question I'll ask before we go off is bats.
Mm-hmm.
So 10 years ago, it was I think because of a certain case that actually was. Now we know more details about it that we didn't know back then. There was a bit of a paranoia about bats and the spread of rabies, that it may not be a contact thing, that it could be airborne, and I feel like that's changed a little bit. The parent or
the fear factor around bats. Yeah, you can see that in the Maine CDC recommendations that just being around a bat doesn't mean you need rabies exposure prophylaxis.
Right.
If you can catch the bat, that'd be great because then they can test
and in 24, 48 hours tell you, don't worry about it. But yeah,
I think certainly bats have fallen out of favor as being fearful. Certainly, foxes and animals like that, animals that are behaving, mammals that are behaving oddly, are
A concern.
much more of a concern these days.
Well, thank you very much.
Yeah, thank you.
Thank
And
you.
I can Laura Blaisdell@gmail.com. I got in early on the Google.
You got
so-
your whole name.
Yeah, I got my whole name, no numbers. So please feel free to email me if you have any questions, and I'll get our information to Ron for the Maine Summer Camp's website.
Super.
And once again, thank you to Androscoggin Bank for supporting these webinars. Thank you, Laura.
Yeah.
That's great.